Hi, I'm Dr. John McCann, and I'm going to talk about surgery in the orbit and the eye socket. There are really a lot of different kinds of surgery which are done in the orbit and the eye socket. Examples would be orbital decompression surgery. That's a surgery that's done to remove bone or fat from the eye socket. I also repair orbital fractures of the eye socket as well as fractures that affect the cheek but extend into the eye socket. Finally, there are patients who have tumors in their eye socket that have to have the tumors removed. Not every bone which is fractured in the face needs to be repaired. So during the initial consultation, I'll sit down with a patient, examine them, and then review the CT scan with the patient, and we'll come to a conclusion together as to whether or not it is a fracture that actually requires repair. If it does require repair, they're usually scheduled for surgery about 2 weeks after the initial trauma. Most of the surgeries take an hour or two to perform under general anesthesia. They're mostly done on an outpatient basis, so you don't have to stay overnight in the hospital. There are wide varieties of different kinds of tumors that grow in the orbit. Fortunately, most of them are benign, such as hemangiomas. There are some which are cancers, such as lymphomas and squamous cell carcinomas. The treatment plan varies tremendously depending on exactly what kind of tumor it is. Most patients who have a tumor in their orbit present with one eye bulging forward. Because of this, a CT or MRI scan is obtained, and the CT or MRI scan outlines where the tumor is at in the orbit and often gives us some idea of what kind of tumor it is. And often prior to surgery, we have a very good idea of whether or not we think the tumor is benign or if it could be cancerous. Based on the examination and the appearance of the tumor on CT scan or MRI scan, a custom plan is set up as to how the tumor will be approached. Most typically, the patient is taken to the operating room and the tumor is removed. The reason it's important to see an orbital specialist when you have an orbital problem is because orbital problems are pretty rare. And general surgeons, even general plastic surgeons, would not have much experience. They might only see one of these kind of problems per year. But by going and seeing someone like me who specializes in these disorders and has done surgeries on thousands of people who have had problems with their orbit, I think I can bring my experience to the problem and help develop a safer and more customized approach to resolving the problem.